Hello, everyone. I'm just waiting for a few more moments to get everyone on board so we can start our monthly webinars, which we usually do on every first Saturday of each month, unless there is 4th of July or some event that we have to, change it to the next Saturday. But usually that's when you see us. We invite one of our surgeons. This time we have Dr. Jackie Osuna with us from Tijuana, right? You're in the hospital, Azar?
Yes, hi everybody. I'm here in Azar, in the hospital Azar, and I'm here to answer all your questions and to talk about bariatric surgery.
Yes, thank you so much. And I am actually in our office in Sacramento, Folsom, Sacramento, and doing the webinar. So, basically, we do every time a raffle for almost half of the surgery package off, which is $2,000 off. And all you have to do is to have a health questionnaire in our system and watch the webinar to the end. We usually release a Zoom poll at one time, and then you just have to answer those questions. Watch for those. Usually I do it before we get to the end, which we do the answer the questions, and all you have to do is fill that out. So if you have not submitted a health questionnaire, just go ahead and go to mexicobariatriccenter.com and there is always a link. You can go to the link where it says health questionnaire, which is your medical history. You submit that and select Dr. Jacqueline Osuna. Just to let you know, if you have submitted a form before that, you don't need to redo it. And we have you in our system. All we have to do is switch your surgeon. But other than that, basically, that's all you have to do. And then we do the raffle at the end. Just a few words about myself. My name is Ron Elli. I'm the CEO and founder of MBC, Mexico Bariatric Center. I've been in the medical tourism industry in Tijuana and other places in Mexico since 2007. Actually, I met Dr. Osuna back in 2010, right? In Guadalajara. And we started MBC under this brand of Mexico Bariatric Center in 2012. I worked on a project, which is Hospital Azar right now. Back in end of 21, we started the hospital last September. It's been one of the most successful things we've done. We go over the hospital later on. As far as we do always have news and updates to stuff we do. We always offering new procedures, new, treatments. One of the bariatric procedures that we started offering with Dr. Osuna is SASSY, which is, we say, get sassy with sassy, and she'll go over the procedure. Is a very new and promising procedure that it's just a moment, sorry. Sorry for delay. So yeah, so this is a alternative procedure that SATI offers. This is a more promising and better procedure than SATI. But anyway, Dr. Osuna is going to touch base on that. We are starting to look into offer Botox and fillers in the hospital. Is just about ready to go out. We been offering hysterectomy and endometriosis gynecological procedure, of course, all minimally invasive. And we started offering orthopedic surgeries like a hip and knee replacement. So these are all new. And another exciting new update is we've been invited to the IFSO Global to perform a live surgery that would be streamed worldwide with one of our highest BMI patients in November. And this is a part of the protocol that they're setting our surgeons with IFSO. And it's basically scientific research that they're going to learn, other surgeons, they're going to learn how we do our procedures down in Hospital Azar. We're basically setting up protocols for the rest of the surgeons. And we've been active in New Zealand, trying to do more, bring more patients from there. Vanessa is our on-the-ground coordinator in New Zealand, and she's been great. She's actually bringing a group in September, November, actually November 21st. I come to New Zealand, to Auckland with Dr. Gutierrez to have a live seminar. And we have every other month, we have a group coming from New Zealand. So September is the first one, November, and then this January. So these are the groups that they're coming. If you want to come by yourself, of course, you know, you're more than welcome. But again, 21st, 22nd, 23rd, I will be with Dr. Gutierrez in Auckland, Palmerston North, and Christchurch. Okay, so look forward to seeing you there. Again, always we have new material on our website, blog posts, news. You know, we just did an article that there is a direct link between obesity and colon cancer. This is a research that just published. You know, again, variety of nutritional support, anything that comes out new, we post on our website. So it's is a great resource for you. So during the presentation, we are going to cover the most frequently asked question that we feel is out there. If you don't hear it, you can post it in the Q&A tab, and we will go over it at the end. The ones that are travel related, I would cover, and Dr. Osuna will cover the rest of it, medical. So these are the topics that we're going to cover today. We'll just cover about obesity, its risks, and how to calculate your goal weight or your ideal weight. What does weight loss surgery, WLS, or bariatric surgery do? What's the magic about it? And then we're going to cover why MBC. We're going to talk about Hospital Azar, the features that we offer in our packages that is the best in the industry, and all the support programs we have for patients. And Dr. Osuna at that point is going to cover all the laparoscopic and endoscopic procedures that we offer, including revisional and reversal procedures and the new SASI procedure. We talk about financing a little, our nutritional program, and then I probably release the Zoom poll back sometime and around that time, and we will go to Q&A session. We'll try to keep this under 2 hours. So if we don't get to the end of the questions, you can circle back and ask us again. But at that time, we do the raffle for $2,000 off of surgery. So we all know what obesity is. Obesity basically is a chronic, complex disease that is growing not only in US, but everywhere else in the world. And we'll see basically the reasons, which is our lifestyle, right? Increased nutrients of food we eat, fast food, sugary drinks. Our body is not used to ultra-processed food, doesn't know what to do with sugar, because historically we haven't been, with less activity with more calories. And of course, stress, comfort eating, not getting enough sleep, and we are used to large portions of food. And that's a huge problem. So in the medical field, there is a formula that you plug in your height and weight and you get a number. That number basically scale you where you in this chart. If you're under 25, over 25, over 30 is called obese. Now, so the criteria for getting surgery from our center is 30, but sometimes actually Dr. Osuna can make evaluation and consider BMI a little less than 30 based on whether you're revision or what your criteria is. And we have no limit of what BMI we can handle in our center. We've done a BMI of as high as 110. And another thing I wanted to say is the BMI is not the only criteria, right? But that's just one criteria. We all have different frames based on our being male or female. That's why if you want to know exactly what your ideal weight is, we need to look into this chart. So this chart shows based on male or female, on frame size, based on height, what would be a ideal body weight. And as you see, like a female that is 5'4" with a frame size, medium frame size, should be around 120. So if this individual weighs 220, they have 100 pounds of extra weight, right? And we say, we're going to go over this. What is the average weight loss based on the procedure? We finding that sleeve averages about 78%. And we'll see there are so many factors that contribute to that. First is the skill of the surgeon, your age, the medication you take, the disease you have, and all that determines how much weight you lose. Of course, your discipline, right? And this is just a tool that you need to work with. You need to change your diet. You need to be active after that. So if you, let's say, 70% losing your extra weight, you'll be ending up at 150. So that's what your after surgery weight is. This is just one factor I mentioned, age, right? So the age changes our ideal weight. As we age, the criteria is different. So when we say average, which means you factoring in all the disease you have, the genetics, all the age again. So these are factors. So when we gain weight, our adipose tissue, which is actually fat cells, change, not only changes in size, it changes in structure. And the structural change is the problem that creates all the obesity-related diseases like diabetes type 2, insensitivity to leptin, even our muscles don't respond to protein and exercise. And that is something that is, experiencing when we age, but when we get obese, that's even kicking in. So when we exercise and we take protein, it's not even answering. So obesity is a major risk factor. 40% of Americans alone, adult Americans, are dealing with this problem. It has so many side effects: heart disease, lung disease, diabetes type 2, inflammation, cancer. I mentioned there is a direct link between obesity and colon cancer. They're finding direct link. Before it was like, okay, it may cause this type of cancer, but now, this is a direct link. So another observation we did during COVID was people who were overweight and obese ended up in the hospital, ended up in ICU, and had a higher chance of dying. And the reason is being that COVID or coronavirus attaches itself to fat cells. The more fat cells you have, the more chance of being affected by COVID. So after COVID, we learned that we need to live a healthy life. We need to do better diet, be active, do exercise. But as in generality, there is no proven long-term solution for obesity when it comes to diet and exercise. It's great, but is not a proven long-term solution. And then since the beginning of human civilization, they look for a magic pill to take and lose weight. Well, it came through the magic pill or injection is Ozempic, and it's type of medication like Ozempic. But we'll see that still is not a proven long-term solution for obesity. So at this point, bariatrics is a proven safe and long-term solution. So this is a definitive solution to lose weight. Now, when we go on diet to lose weight, our body reacts and try to put a hurdle against us to reach our goal weight. And the reason being is because our body, which is our brain and hormones, are interacting at a certain level. Let's say if I weigh 250 pounds, my body is used to that. We call it a thermostat or a metabolic set point, however you want to call it. When we try to change that, let's say you go on extreme diet and you do boot camp type of exercise, and let's say you manage to lose 75 pounds. That's an accomplishment, but it's doable. At 175, your brain and your hormones are still used to that 250. They want to take you back to 250. Therefore, your hunger is increased, your metabolism goes down. Now, if I went through bariatric surgery, the minute I wake up, because of hormonal changes, my metabolic system is calibrated, is reset to a new weight, which is 175, for example. Therefore, I'm going to be less hungry and my metabolism goes up, which means it's going to burn fat and I won't be eating as much. This is the magic. This is the difference between diet and exercise and bariatric surgery. Now, what they did with Ozempic type of medication, they try to simulate the hormonal effects of bariatric surgery by giving you synthetic, which is like a fake GLP-1, for example, right? If you look at the right side of my screen, you see that these are the hormones that are naturally changing or reoccurring as a result of the bariatric and metabolic procedure. But only they are simulating GLP-1, for example, and then some of them, like Manjaro, has the second component, which is the GIP, but still is missing so many. And so you're injecting these hormones to simulate the effect of naturally occurring hormones as a result of bariatric surgery. And then, like I said, like Wegovy and Ozempic were what they call semaglutide and tirzepatide, which is the newer one with the GIP, which is Zepbound and Mounjaro. And now they're working on a pill. I even saw the patch the other day, which is interesting. But so there are so many issues with Ozempic. It's a great medication, still can be used with some of the patients that had bariatrics, but is not a definitive answer. So this is a new research came out that they're saying 12% regain weight in 12 months, 70% stop in the first year because of stomach issues, and because so the craving control goes away because you get used to that. And then after 2 years, basically more than 5 times the patients have stopped taking it and they're regaining the weight. So here's the pyramid I like to show like the effectiveness of different tools we have to lose weight, right? Diet and exercise is great, but only works for so little people. You have to be disciplined, you be able to work out all the time, and not everyone can do. And remember, this is not a simple disease, it's a complex disease. So then it becomes the injections and the medications like Mounjaro. And then it becomes another category, which is gastric balloon and ESG, which is endosleep. Those are great tools too, but it doesn't work for a lot of people. And still is great tools. You have to look into different ways to lose weight. So the gold standard still is a gastric sleeve bypass duodenal switch, which works for majority of people. Now, the problem is people either don't have insurance or their insurance doesn't completely cover. They have so much deductions to pay and so many hoops to jump into. So they looking to go into Mexico. Mexico has established itself as one of the top centers in the world for bariatric surgery, especially Tijuana. And our company is in the forefront of all this. And so you see individual surgeons that they offer this, but I will go over that later. They don't have a company like NBC to support all this, from the driving, from the hotel reservation, from the making sure the surgeon is doing the right thing, the hospital is doing the right thing. We are basically setting regulation in this industry. And there are so many benefits. For example, one of the benefits we offer optional medical tourism insurance for $99. So that's a huge benefit that you get going with a company with us. And, we've been in the industry, like I said, since 2012, and we are a US-based corporation. Right now, if you look, there are not very many companies that are US based. And we are running everything like it's done in US. We have 13 years in the medical tourism. We've done more than 28,000 surgeries. This is not, we're just not throwing these numbers. Since we started publishing these numbers, everybody is jumping on the bandwagon. Oh, we've done 13,000, we've done 5,000. You need to look for the list of the patients to, well, say, show me the list. But anyway, so we work with top 5 bariatric surgical teams. These are individual teams. They're not just one surgeon working with another surgeon. No, no, no. These are different teams. Like, for example, Dr. Osuna has her assistant surgeon, her anesthesiologist, instrumentation, nurse, doctor. They're all separate teams operating separately. We do manage their loads. That's another benefit coming with us. We give them enough surgery per day, but we don't overload them. And that's one of the reasons our complication rates are low. And I always compare assistant surgeon and experienced surgeon. For example, Dr. Usuna, she's been with us. I've been with her, knowing her for what now? 14, 15 years. This is the kind of experience they have. They're not just started being assistant surgeon 2 years ago and now they're working on their own and they're offering this surgery. Look, it's the same concept of pilot and surgeon. The pilot with 1,000 or 10,000 hours of flight time has better experience and saves your life when it matters. So you don't want to give your life to a pilot that is not experienced, because yeah, most of the time nothing happens, but that one time that you need that experience, you won't have it, and this is going to cost your life. So be careful with social media. It's a great tool. They put cute things on Instagram, TikTok, Facebook to catch your eyes and trying to convince you to go with them. But please do a research to know who is behind the company. Just having a website and social media presence doesn't mean that they would be able to do a good job for you. So looking to see who is behind the company, who is doing the surgery, what are the surgeons, what are the qualifications of the hospital, certifications of the hospital. This is actually goes back to say it to you. They don't know what's about it. Sixteen of September, lighting up with highway forward. Never today, 4,000 miles to the next stop. Well, this is not Photoshop video. This is Hospital Azar. I started working on this project in 21. We started actually servicing our patients September of last year. The name is a tribute to my mother, Azar, and it has the best of the best technology and patient's comfort in mind. All the rooms have view of outside, the glass windows. We have more than 40 beds, 4 ORs fully equipped, and in-house labs and X-ray and all that. This is one of the best. Well, here's the thing. This is not a hospital that does heart surgery and they take walk-in emergency. This was made for medical tourists going to Mexico, Tijuana, and getting weight loss and plastics surgeries. And this is based on the experience that we have had. I've had so many years. This blueprint is based on that. And that's why it makes it unique. It's not just a certified hospital that they just built, in Mexico. So we do have a new policy that we let companions stay with the patient in the hospital. We couldn't do it during COVID, but we are happy to offer that. The patient companion has option to stay, whether in Hyatt, of course, the first night they're together. Once the patient is in the hospital, you can join them in the hospital or stay behind in Hyatt. This is just your choice. We have streamlined all of our protocols and procedures. So it's very simple. You submit a health questionnaire. You get your approval. At that time, you can actually go and online and make a deposit and book your surgery based on your availability and the surgeon's availability. Okay? So it's that simple. Once you have booked your flight, booked your surgery, now you can arrange for your flight or you're driving, however you're coming, and we finish your paperwork, you're ready to go. Our all-inclusive packages include all that you need, but I need to make addition here to say, okay, so let's say we would cover that. Actually, Dr. Osuna is going to cover. Let's say if Dr. Osuna finds a hiatal hernia during the procedure, all of our surgeons check for that. This is something needs to be repaired for you to not have, Dr. Osuna is going to explain all that, not to have reflux problem, other problems down the line. So they actually going out of their way to detect that so you have a successful surgery. So there will be additional fee if they find there is a hiatal hernia. Some people come knowing they do have it and they ask us, but the ones they don't know, and that's one of the problems with gastric sleeve, right? Gastric sleeve reflux can be coming from so many different ways, and that could be one of them. If the surgeon doesn't fix that, you're going to have reflux problem. And then you have to go get a revision because you think the surgery didn't work, but it wasn't really surgery. It was that the surgeon didn't do their work. They didn't look for all that they have to look for. So certain things, like for example, there are occasions that we need to do extra lab work based on the patient's situation. Yes, we say the lab work, the pre-op lab work is included, but I would say in 50 or 100 needs additional labs done. So we need to do that, but then it's outside the package. The same thing with medications. Our standard medication is good for all patients, but there are some patients that they need some more pain medication or some more nausea medication, or they may need something for their heart condition. So we don't know. This is a surgery. This is not, you're not going to some vacation. So we have to remember, we have to do what it takes for us to keep you the best condition and keep your well-being in mind. So these are our standard packages, but in case there is a hernia repair, there is extra lab or extra medication, then you have to pay those extras. And then another that I mentioned about medical tourism insurance, MTI, that's also optional. For $99, you can purchase that. And we give you option to do it. Even the last moment, if you're there and you decide before surgery you want to do it, you can still add it. I highly recommend, we will go over it a little later on. I highly recommend you take advantage of this package because it covers so much, and it's better to have it and not use it, but not have it if you need it. Our support, I was talking about our support before and after surgery. We have several Facebook groups. These are all private groups. Like, for example, our main Facebook groups is private groups only for past patients. And it consists about 13, 14,000 patients. We have another one which we call Inside. Inside is for people who want to know what it's like to have surgery with MBC and your MBC family. There are so many specific ones that you can join once you have surgery. We do live Q&A with our surgeons every Wednesday, 10 a.m. Pacific time, PST, 10 a.m. on Wednesdays. Every surgeon takes turn and they can answer all your questions. If you don't get your question answered here, we have our coordinators go live. This is the team of our what we call affiliates. These are past patients that are working with us day in, day out. I'm not saying day in, day out. I really mean it. Like Sarita she's 24/7. Rena, the same. I mean, these are, they work with NBC because they love the company and what their experience with us and their success. They see what the surgery has done for them and what NBC has done for them. And they're so passionate about their jobs. And we really love to work with them. Anna, for example, she's from Canada. Vanessa, I mentioned, she's from New Zealand. Taylor and Stacy. Taylor just joined us. Stacy, kind of new, but this is a team. Tiffany is now doing the plastics. So we do have staff here in our office, but these are our past patients working with us. Rena and Sarita do the podcast. I highly recommend you watch those. For people who joined later, if you fill out a health questionnaire or you do have a health questionnaire, you're eligible to join the $2,000 off of surgery raffle. We will do it at the end. And all you have to do is have a HQ in our system and fill out the Zoom poll that I would release in later on. This is the 5 team of surgical team I mentioned, right? Dr. Miguel Montalvo, Alejandro Gutierrez, he's our chief surgeon, Dr. Rodriguez Lopez, Dr. Jackie Osuna, which is here with me, and Jesus Ceja. We have complex ways and routines to match you with the best surgeon for you. Our surgeon liaison examines all the HQs going between you and the surgeon. She's a American doctor that was actually educated. She got her education from Guadalajara University in Mexico, and we use Hyatt mainly for our patients or companion. Our pre-op diet is very simple. Based on your BMI, you do from 2-day clear liquid all the way to few weeks of pre-op diet. This is very important to do a good job on your pre-op diet, okay? You're doing yourself and the surgeon a service by doing a good job, and it shows your commitment to this tool that you're acquiring, because it shows that how successful you are. We were talking about the success rate. That's one of them. Do a good job on pre-op diet, you get yourself easier surgery and better post-op recovery and better weight loss. Medications, we tell you what to stop and start, but as a rule of thumb, you need to stop NSAIDs and blood thinners 1 week before. Ozempic, if you're taking Ozempic, Mounjaro, all that, take 2 to 3 weeks before stop. No smoking, please, before and after. That's huge. And just, just make sure you comply with the instruction they're given to you. We want you to arrive before noon, so we will have enough time to do your pre-ops and make all the arrangements we need to do to get you ready. And want you to depart around 2 p.m. We do use medical pass, but again, it's so many variables to get you out of the border. I highly recommend everybody to bring a passport card or a passport book. Especially, now they're checking more and more. They're more strict about crossing. And the day that you arrive, just relax, do the pre-op. We provide broth, jello, and of course, before surgery, and your companion, if they stay in Hyatt, they take advantage of the free breakfast. On the day of surgery, we get you ready, whether you stay in the hospital or Hyatt or hotel. If you're in a hotel, they transport you to the hospital. If you're in the hospital already, you just get ready, have the surgery done. You stay 2 to 3 nights based on your procedure. We do all the leak tests, everything. You're ready to go home. And our post-op diet is also very important piece of this. Is a 4 weeks of clear liquid to solid gradually. That's very important. We do have extensive support for nutrition. We have actually a nutritionist not only in-house here in our Folsom office. And this is I was talking about the percentage. In 18 months, remember, you're still going to lose until 2 years and beyond. But at 18 months, our sleeve patients averaged 74% of their extra weight. RMY bypass, 80. This is 18 months. Mini bypass, about the same. And duodenal switch, 86%. These are great numbers that we achieve. Only less than 5% of our patients need revision. We do a lot of revision surgeries because they come from other centers. They didn't do the sleeve right, or they didn't lose all the weight with sleeve, they come back. But only from our patients, 5% go through revisions. And the reason, 74% of those have insufficient weight loss. Okay, so I get to introduce Dr. Jacqueline Osuna. We say Dr. Jackie. We call her. Like I said, she's one of the most experienced bariatric surgeons in, I would say, Mexico. I met her in 2010. She has over 18 years of doing this type of surgeries. She's a board certified surgeon, of course, and she performs all type of surgeries from gastric sleeve to bypass, duodenal switch revisions. And I'm going to let her take over and talk about all the procedures that we offer and explain the differences. And then I would take over and talk about financing. Thank you so much, Dr. Osuna.
Hi, everyone. Welcome to this webinar. I'm Dr. Jackie Osuna. Like Ron told you before, I perform all types of bariatric procedures because I believe that there is not a procedure for every patient. I think that there is a specific procedure for a specific patients. That's why it's so important to decide the best surgery for each patient. Okay, when we are talking about bariatric procedures, what are my options? We have the laparoscopic surgeries and we have the endoscopic therapy. The laparoscopic surgeries include gastric banding, that is, in this moment, we are taking off the bands that the surgeons put before. The gastric sleeve surgery, the mini gastric sleeve, the single incision gastric sleeve, R&Y gastric bypass, mini gastric bypass. And after that, we have the ileal surgeries group. In the ileal surgery group is the duodenal switch, the SASIs, the SADIs, and other modification of these procedures. But when we are talking about ileal procedures, it means that we connect the upper part of your digestive tract to the distal bowel. We're going to talk about that procedures in a few minutes. And the various laparoscopic gastric revisions surgery and the gastric bypass reversal if the patients need it. In the endoscopic therapy, we have the gastric balloon, the endoscopic sleeve gastrectomy, and the endoscopic bypass revision, and the robotics too. Okay, first we have the gastric sleeve surgery. The gastric sleeve surgery, it's a very known procedure that in which we remove the 80 to 85% of your stomach using 1 to 2 to 5 tiny incisions. And we use a boogie to calibrate and give the shape to your new stomach. In these procedures, you are going to lose weight because it's a restriction that limits the food intake. We have a change in the gut hormones that cause the hunger and satiety. And the gastric sleeve surgery is low gastric emptying. What is the expectations with this procedure? Okay, we're going to have a decrease in the level of ghrelin, that is the hunger hormone, an increase of the level of GLP-1, increase the levels of PYY, and we don't have any change in the GIP hormone. The pros of this procedure is that it could be easily revised if it's needed. High amount of excessive weight loss compared with gastric bypass. We could have a resolution of comorbidities, and we don't change the anatomy of the digestive tract and less malabsorption. The recovery time is short. And the cons that can worsen the pre-existing acid reflux or GERD. That's why it's so important that you mention that in your health questionnaire to advise the best procedure. And the excess weight loss is around 72%. It depends in which stage you are, but it's the average in 1 year. Okay, the single incision gastric sleeve surgery is, this operation is performed through the opening through only 1.5 inches in the umbilical area. It's a hidden incision, and the procedure is like inside is like a gastric sleeve. The only difference is the approach. The expectations is similar to the gastric sleeve, is decrease of the levels of the ghrelin, that is the hunger hormone, increase the levels of GLP and PYY hormone, and no change in GIP. Okay, like I explained you, same results at vertical sleeve gastrectomy. The pros are similar too, can be easily revised if it's needed, high excess weight loss compared with gastric bypass, resolution of the comorbidities, and no change in the malabsorption in the anatomy, and less malabsorptive. The recovery time is short too, and these have the aesthetic approach and faster recovery because it's the single incision. And the cons is the same, can worsen the acid reflux, is non-reversible, and in this we have to have no higher BMI. It could be 40 or 45, but depends of the patient. And the excess weight loss is comparative with the gastric sleeve because it's inside it's the same to the 72% in the first year. Okay. The endoscopic gastric sleeve is a smaller stomach is formed, folding the stomach to create a banana shape. These procedures have a restriction and limit the intake that you are going to have. The expectation is hold less food and decrease the food intake, lower amounts of sex weight loss, and there is no change in the gut hormones, but is not well suited for patients with gastrointestinal bleeding or large hiatal hernia. The pros is that is reversible, reduce the complication rate because it's endoscopic, and non-incisions and removing tissues. The recovery time is shorter, and the cons has a potential risk of partial openings in the small pouch and potential risk of ulcers. And the excess weight loss is around 40% in the first year. Okay, the gastric bypass surgery, the R&Y. Gastric bypass surgery forms a new pouch while the remaining stomach stay in place. We don't take off the stomach, the remaining stomach. The small intestine are rerouted to bypass food digestion, which creates malabsorption and reduce calories intakes. The expectations in the gastric bypass is only a slight decrease in the ghrelin because we don't take off that part of the stomach that produce the ghrelin. But we have an increase of levels of GLP and PYY, and the GIP is decreased too. That situations is important because it's a metabolic procedure. The pros of the gastric bypass surgery is that is the gold standard in the bariatric surgery, is a high amount of excess weight loss, and improves obesity-related comorbidities like diabetes, high blood pressure, and sleep apnea. The cons is that you could develop the dumping syndrome, but if you follow the instruction, the nutritional instructions, is less probably that you have and a higher risk of ulcers. And the excess weight loss after 1 year is around 75%. Okay, some patients ask, what is the best surgery for me? For example, if you're a patient with BMI of 30 or more and you have a previous scar tissue because of previous abdominal surgery and you have previous ulcer, you could be a best patient for a gastric sleeve. And we have to remember that the gastric sleeve is easily to revise if it's needed, and you don't have any altering of the anatomy of the abdomen of the digestive tract. If you are a patient with 35 to 55 of BMI, and you have the acid reflux for GERD, and you have slower metabolism, you are a sweet tooth, or you have metabolic diseases, the best option could be gastric bypass. And we have to remember that in this procedure, we alter the anatomy of the digestive tract. Okay, the mini gastric bypass. The mini gastric bypass is too similar to the gastric bypass, the R&Y. The only difference is that in the mini gastric bypass, we have one anastomosis, one connection in the stomach to the bowel. And in the R&Y, we have two connections. The mini gastric bypass divides the upper portion of the stomach to a tube, like a pouch, that holds only 2 to 6 ounces of food. The intestine is looped to connected to the new stomach and decrease the amount of calories you absorb. The expectation is that reduce the feeling of hunger through the altered gut is, okay, the next, please. Okay, the other one. Okay. Okay, we are talking about mini gastric bypass that reduce the calories and the nutrition absorbed and resolves or treats the diabetes type 2 and other chronic diseases like high blood pressure or sleep apnea. The pros in the mini gastric bypass is that you are going to have one connection in the bowels. It's safe, effective, and shorter procedure than the R&Y because it's one anastomosis, and one is the most effective surgery to revise if we have a fail in a previous procedure, for example, in the lap band or in gastric sleeve. The cons are that you could develop the dumping syndrome too, and the higher risk of ulcers. And you could have the possibility of a bile reflux. It's not frequently, but could happen. And the excess weight loss is around 76 in the first year. Okay. Okay. Comparing the gastric bypass and the mini gastric bypass, the most important difference to decide it is that if you have previous acid reflux or GERD. If you have previous acid reflux or GERD, the best option is R&Y bypass because are similar in the excess weight loss to treat the chronic diseases, and the malabsorption is similar. But the most important thing is checking if you have previous acid reflux or GERD. Okay, in the beginning, I talk about the ileal surgeries group. In the ileal surgery groups, we have the DS, we have the SARIS, we have the SASIS, and the other modifications. We're going to talk about two specific ileal surgeries, that is the duodenal switch first. The duodenal switch surgery is also known as biliopancreatic diversion with a duodenal switch. Is a powerful weight loss and metabolic surgery. Okay, the expectation in these patients is to lose to 60 to 80 of excess weight in the first year. A high percentage of duodenal switch patients type 2 are cured or have a remission of the disease. Malnutrition is a problem, but if you follow the instructions, you could avoid that complication. But you have to. But the nutrition is a must in this surgery. The pros is up to 80 excess weight loss in the first year. The stomach size is reduced, and the highest metabolic effect and the highest expected weight loss. And the cons, extremely strict vitamins required for life, and higher risk of than other bariatric procedures. The excess weight loss, like I mentioned before, is 80% in the first year. Okay, the SASIS. The SASIS is a single anastomosis stomach ileal. In the SASIS, is a ileal surgery too. And this is a relative new procedure that combines the benefits of the gastric sleeve and the mini bypass. But the important, it's more potential is that in the mini bypass, because the anastomosis is in the distal part of the bowel. That means that you are going to have more hypoabsorptive procedure, okay? And reduces the nutritional risk compared with the duodenal switch. It preserves natural digestion, lowering deficiencies risk beyond restriction, SASIT harness hormonal shifts in GLP-1 and GIP, and gut microbiome changes for metabolic benefits. In this procedure, the expectation is to lose 65 to 75% of excess weight in the first year. High percentage of the duodenal, in this case, the SASIS, has a remission of the diabetes and other diseases, and is less complex than SADIS. The SADIS is, the difference here is where is the connection in the ileal surgeries. In the ileal surgeries, the important thing and the difference between surgeries is what you are going to connect with what part of your intestinal. Okay, the pros in the SASIS is that you are going to have a 75 excess weight loss in the first year. Is less cutting and stapling than in the duodenal switch, less risk of the leaks and acid reflux and nutrients deficiencies compared with the duodenal switch, and can be revised to a gastric sleeve, mini gastric bypass, RNY, and SADIS too. We have more options in this procedure. And the cons are, it's a relative new procedure, and you have to have lifelong bariatric vitamins and mineral supplementation. Like I explained you before, the excess weight loss is around 75% in the first year. Okay, some patients ask, what is the best procedure, duodenal switch or SADIS? Here are two similar. The only difference is that in the SADIS, we only have one anastomosis, one connection, to the duodenum with the ileum. And in the duodenal switch, we have two connections. That's why SADIS, it's indicated in patients that we want to have less time in the operating room, and when the patients, we prefer have less risks because we have only one anastomosis, but they are similar in the excess weight loss and in the remission of the metabolic diseases. Okay. Both of these surgeries, SASIS and SADIS, are ileal surgeries that I am talking to you before. Ileal surgeries is a group of surgeries that connect the upper part of your digestive tract with the distal intestine that lies in a hypoabsorptive procedure. The difference between these procedures here is where the connection is made. In the SASIS, the connection is made to the sleeve, to the stomach, to a distal duodenum, to a distal ileum. In the SADIS, the connection is the duodenum to the ileum. That lies in a less risk in a SASIS procedure. The malabsorptive is the same, but the connection is in a different place. In the SADIS, is contraindicated in patients that have acid reflux, but SASIS is not contraindicated in patients that have acid reflux. That is the difference, because the connection is in a different place, but the hypoabsorptive procedure is the same. They have the same indications in patients that have metabolic diseases, but the difference is it's less risk in SASIS because of the place of the anastomosis, and less risk of acid reflux in the SASIS. If you have previous acid reflux, it's better SASIS than SADIS. Okay, like Ron explained you before, in our group in Mexico Bariatric Center, we don't have so much patients that need a second surgery, because we try to choose the best procedure in the initial since the beginning. Okay, but the revisional surgery sometimes is needed. The revisional surgery is to repair, revising, or moving to another bariatric procedure. For example, the lat band could be revision to a gastric sleeve, or RNY, mini gastric bypass, or SASIS and SADIS too. The gastric sleeve could be revised to a resleeve, RNY, mini gastric bypass, duodenal switch, and SASIS. The gastric bypass could be revisited to do a revision of the bypass, or endoscopic procedure, or to a duodenal switch. And the duodenal switch could be revisited, the duodenal switch, to check in that the length of the limbs are correctly, or to a RNY bypass. We also do revisions for gastric balloon, endoscopic gastric sleeve, vertical banded gastroplasty, or reversals when it's needed. The expectation in a revisional surgery is lose weight that was regained after a previous bariatric surgery. Switch to a surgery that is more effective or better for the patient, or resolve issues from the previous surgery. The pros is that you are going to lose the weight again, and relieve complications, for example, the GERD, or weight loss may be more effective. And the cons is the risk of complications and the longer recovery time. And the excess weight loss, it's around 72% in the first year. Okay, Ron talked about the hiatal hernia repair. The hiatal hernia repair in the overweight and in obesity patients is so frequently, because one of the causes of the hiatal hernia is in the increase of the abdominal pressure that makes a hiatal hernia. What is important to repair when we made the bariatric surgery? The importance of the repair is because if you will find it, is a hole in the diaphragm. When we made the surgery, we alterate the anatomy of the digestive tract, and we take the adhesions that avoid the migration of your stomach to the chest, if you have it. But when we made the bariatric surgery, we take off all the adhesions. That's why we have to protect and prevent the migration of the sleeve or the pouch when we find it. The hiatal hernia occurs when a part of the stomach pushes through the diaphragm. And some patients have symptoms, but some patients doesn't have any symptom. And surgeons typically fix the hernia at the same time of performing a gastric sleeve or a bariatric procedure. The expectations is that it's so common. We have 1 in 3 bariatric patients has a hiatal hernia. A small hernias repair during gastric sleep because when we make the sleep, we take off all the left part of the adhesions in the stomach, and it's like a small tooth. If we don't close the hole, the sleep is gonna migrate to the chest. And if you don't have previous acid reflux, you are going to develop. If you have previous acid reflux and we don't repair, it could get worse, okay? And the repairs are done laparoscopic, and we have to know that the unrepaired hernias can cause a serious issues after surgery, or acid reflux, or the migration of the sleeve or the pouch to the chest. And it could be a complication that cause emergency surgery sometimes. That's why it's important to know that this so frequently, and we have to repair if we find it. Sorry. The bariatric surgery helps to the polycystic ovary syndrome that is so frequent too in obesity patients, reduce the symptoms and helps restore the normal ovulation. And numerous weight loss surgery patients of bariatric, Mexico bariatric surgery with PCOS have been cured and overcome infertility. That is so important and is going to help to regulate your hormones. After a bariatric surgery, some patients think that they have to have a lot of incapacity, but it's not the reality. The advantage of the laparoscopic surgery makes that that kind of procedures have a very faster recovery. Here we have the time of every procedure, but it depends of the work that you perform. If you, and we're going to give you all the post-op instructions about the lifting or about your exercise, but your recovery is going to be so faster.
Thank you so much, Dr. Osuna. I'm going to take over from here. We have been treating more people for skin removals and other cosmetic and plastic surgeries in Hospital Azar. And our program is really in demand right now. So we do all type of procedures, whether it's skin removal. And remember something, if you are a post-bariatric patient and you want to do any type of plastic surgery, you need to have not only a board-certified plastic surgeon work on you, you need to have that plastic surgeon have experience in post-bariatric patient. This is very important to look into and not just go with any plastic surgeon. Again, we do any type of facelift, whether it's mid-face, we call them mini facelift, which is mid-face, neck, and jaw lines. And we do always fat grafting. If you combine that with eyelid or forehead, then we call it full facelift. Nose surgery, tummy tuck, whether it's mini, full, extended, circular, butterfly, torsoplasty. Some patients need all this. They need a butterfly and torsoplasty. And we call mummy makeover is a very popular procedure, which is a multiple procedures in one operation. Not only the patients that come for mummy makeover, not only they save money, they get all that done in one surgery. Of course, we limit the number of hours that you're in the OR, but we do multiple surgeries. Again, we cannot do everything at one time. Some patients come, they want their face and tummy tuck. No, it's dangerous. It can cause life-threatening if you do too many. So we have certain protocols, and we tell you this is what we can do in one operation. Usually, tummy tuck and breast lift is pretty good in one operation. We do Brazilian butt lift, BBL, arm lift, thigh lift, and again, part of the gynecology, which is hysterectomy and endometriosis. And we started doing orthopedic, which is knee and hip replacement. So actually, I have Kelly, which is one of the affiliates I mentioned earlier, to join us live. Let me find her and let her share her experience with us. Okay. She would she'll share her story with us. Okay. Hi, Kelly. I hope you hear me, and I let you to panelist if you're still there. There you go. She's joining. You're on mute. There you go. Hi, Kelly. How are you?
Hey, can you see me?
Yes, we hear you and we see you.
Okay, I'm going to go ahead and stand up so you guys could actually see my results that NBC and NCC gave me.
Yeah,
I'm wearing this outfit so you can actually see. So if you saw me before, I started off at 220 pounds 4 years ago. When I weighed in, I was actually 200 pounds. I went from a size 14 to a size 2, and I think I'm actually at a size 0 now. So I lost almost 100 pounds within 8 months. I went to 125 was my lowest weight. I'm at 127 right now, maintaining it for 4 years. July the 13th was my actually anniversary for 4 years. That's why I actually have a 4 on my wall. Then 8 months post-op from Mommy Makeover, I had a muscle repair, extended tummy tuck, 360 lipo, hip fillers, and a skinny BBL. If a lot of y'all might not know what a skinny BBL is, it's just it kind of does like a lift. I didn't want it too much, so I just kind of want it portioned. And before, I never had, you can see my brand new belly button. Thank you. And I never had any hips whatsoever. So these are new. But I just want to say thank you for giving my life back. I'm 51, going on 52 years old. If you're sitting on the table, do it. This is like the candle on the cake, the last piece of the puzzle. I couldn't be happier, and I love y'all, and thank you for giving me my life, and I appreciate you and everybody. Hi, Dr. Osuna. But I'm actually going out there. I'm going out there August the 18th through the 25th. So I'm going to do a meet and greet. I hope to meet everybody, even though I'm not your coordinator. I hope to meet everybody there, and I'll be out there daily. We are going to be filming, so I just want to give you guys an update. And if anybody needs a companion, I will be there.
Yes, and what airport are you coming from?
I'm leaving from Texas. I live in Texas, Midland, Texas, but Dallas, San Antonio, Austin, Lubbock, El Paso. Those are all my near big states that anybody that's coming from there. Okay, happy to join me.
Yeah, but which airport are you flying out of?
Midland International Airport.
Which one?
Midland, it's Midland Odessa International Airport.
Okay, okay. All right.
Yeah.
Yeah,
Yes.
so if people want to join her and come down with her, we still have time.
Yeah.
So how many days? You said 18th, August. So
18th
you
through the
actually
25th.
you're leaving on 18th?
Yes, I'm leaving on the 18th. I'm coming also as a companion. My sister is actually having a whole mommy makeover herself. So I'm going to be her companion as well. So we'll be, Cher's actually having her surgery on the 19th. So I'll be there before noon on the 18th for pickup.
Okay, awesome. Well, thank you so much for sharing your experience. It's great to have you in our team.
Thank you.
Yeah, thank you. I hope to see
Happy
you
to be
down there
here.
too.
I know you need to come down and visit me, and I'm definitely going to come and see you, Ozuna.
Yes.
Yeah.
Okay, thank you so much, Kelly.
You're welcome.
Yeah, that's her
Wow.
that's her success story. We call total transformation, right? Not only you lose weight, you go, like she said, is the icing on the cake or the candle on the cake. Okay, so I think I did release the Zoom poll, and I look like so many people did it. I'm going to see if there is any more that we didn't cover. Okay, so the financing is the one piece that I wanted to touch base on, the medical tourism insurance. So financing basically, if you need to borrow money, this is a really affordable packages right now we have. This is the lowest prices we've ever had. And if you need to get money, probably your bank could be the first place if you have a good relationship with, if you have a credit union. And but don't apply for so many loans in one time because it's going to hit your credit score. Okay. You can also look into, some people, what they do is they make the deposit and they start making payment toward their surgery. Your balance is due 15 days prior to the surgery, whether you taking a cashier check or you paying Zelle. We have Zelle option, credit card option, so you can be creative and find ways to pay it. If not, SoFi, we have several resources on our website. Canadians go with Medicard is all on our website. You can take a look. And just one more touch on the NTI. This is a great coverage to have for $99, optional, but everyone needs to take this and sign up. We mentioned about our nutritional program is extensive. Part of your recovery and your success, and to be honest with you, long-term success is the bariatric vitamins. Bariatric vitamins is made based on the requirements for post-bariatric patients. They're not just like multivitamin. You need to take what your body needs after surgery, specifically to the proportion of the supplements you need, and that's why it's important to look into Emerge Bariatrics. You can go on emergebariatrics.com and buy this, or order it when you are filling out your paperwork. It comes in soft chew, chewable, drinkable, and capsules. So we mentioned, okay, so I think we got to a point that we're gonna open up for questioning, answering the frequently asked questions. So the first one is asking, as a man, Dr. Osuna, this is for you. Does VSG, sleep surgery, VSG, help testosterone levels?
Hi. All the procedures have an effect in the hormones, but the procedures that have better effects for the hormones are bypass, mini bypass, duodenal switch. The gastric sleeve could help because once you begin the losing weight, the hormones begins to getting fixed. But the most important procedures that helps to better your levels, it's metabolic procedures, like I explained you before. Gastric bypass, mini gastric bypass, duodenal switch, SADIS, it's more effective in that situations than gastric sleeve.
Okay, this one I'm going to answer. It says, how safe is it to come alone and it's out of the state? Well, I would say more than 50% of our patients come alone. Remember, you're always around our staff, you're always around our people. We have coordinators in the hotel, of course, the drivers, the coordinators in the hospital. So we always have people from our company around you. You get picked up from San Diego International Airport, you go to the hospital, you go to the hotel, there's always somebody escorting you. So you're never alone. You have other patients. They become lifetime buddies when they go alone, and they find other friends that they can hook up with and relate to. So it's perfectly okay to come by yourself. Tina is asking, how much is the cost of doing additional surgery? If you are talking about like hernia repair and things like that, I don't know which one is additional, but those are like usually around $400. Again, all the charges are extremely affordable. I mean, what we do as a hernia repair, it would cost thousands in US if you were to do it. We try to do this very, very charge you minimal as little as possible so we can offer all these extras to you. Valerie is asking, what type of complications do you see after RNY revision?
Okay, after RNY revision, the most important thing here is that we have to take off all the scar tissue of your previous surgery. The risk as a leak in that part of the intestine, of the bowels, but the percentage is too low. It's around 0.02%. The most important risk could be the leak, but once you leave the hospital, we are pretty sure that you don't have any leak because we perform leak tests in the operating room, two leak tests in the operating room, and the final test is 1 day after surgery, that is the fluoroscopy. And when you leave the hospital, we are pretty sure that you don't have any complication. But that is the most important complication that you could have, but is very low incidence.
Keisha is asking, do you guys offer gastric plication?
Gastric plication is a procedure that is not too well advised because you have a very high risk of develop the bleeding in that part of the stomach that we take off all the blood supply, and the weight loss is not significant, and the revision of that surgeries, it could be very complicated. That's why we better advise the gastric sleeve because it's more effective than the application and less complications.
You know, just to give a side note, there was some companies that they weren't able to do all these complicated procedures. They start offering gastric plication because it's rather simple procedures, but it's not. We see that often that we have to revise them. With gastric bypass, do you have to take vitamins for the rest of your life?
After a gastric bypass, you have to supply of your vitamins and supplements because we reroute the bowel and we avoid the part of your digestive tract that absorb the nutrients, and that part absorb the fat too. But that's why you have to have the nutrimental forever, because that part of your bowel, of your intestines, are reroute, and we avoid that part when you consume. That's why the supplementation in bypass is a must.
This is an interesting question. I am a singer by profession for a very demanding musical. My character requires a lot of effort, especially all around my abdominal muscles. How long will it take for me to be fully capable of going back to work?
Okay, normally you are coming back to your job 1 to 2 weeks after. In that case, we advise more time because we are a fourth in the diaphragm, and the advice is to wait 3 weeks, but you have to begin slowly because it's an effort in the diaphragm and in the surgery too. 3 weeks are good.
Okay, so that's actually a great question I was going to cover anyway. And then something about like I was just reading that people who are obese have 4 times more, that this is back to hiatal hernia, 4 times more chance of having hiatal hernia than a normal person. So obesity really causes hiatal hernia. Now back to MTI, the MTI only covers the complications that causes from the surgery itself. For example, hiatal hernia is some condition that you have already, and when we repair it, is not considered a medical insurance coverage. But so that's different, right? So hiatal hernia is like a condition you have and needs to be fixed. So that doesn't cover, MTI doesn't cover that. Okay, so this is another good one. It says, how many months can someone wait after they have fibroids removed to have sleeve done? Now, I know that's a question for Dr. Osuna, but we are capable of doing these both procedures at the same time. We can do a gastric sleeve with hysterectomy or fibroid at the same time. They're both done laparoscopically. So the limit, this is the limit. For the cosmetics, we can do eyelid with the sleeve and we can do fibroids and hysterectomy with gastric sleeve. So you don't have to do it in twice. But if your fibroids is covered with your insurance in the US, now Dr. Osuna needs to answer. How many months they have to wait after gastric sleeve to do fibroids removal? You are on mute, Dr. Osuna, you're on mute.
Sorry. Like Ron explained you before, this procedure could perform at the same time. But if you have previous fibroids and you are going to schedule a laparoscopic procedure, it depends how was taken off. If was laparoscopic or was open incision, but 1 month is enough to the other surgery, and 1 month is the most time that you have to wait, but it could be performed at the same time, like Ron explained you before.
Now, I saw another, actually, this is interesting because I touched base on the cosmetic done with bariatrics at the same time, and I said eyelid is the only one we do. We see other centers that they take more complicated plastic surgeries with sleeve or bypass. We don't do that. So here's the thing. It's easy for us for just making money to do all sort of things, but we don't want to jeopardize patients' safety and well-being. Remember, everything we're doing is your safety and your well-being is number one priority. Okay. So that's why, like, if you come to us and say, I want my face done with my tummy tuck and this and that, we won't do it. Maybe some surgeons do it to make money, or they're desperate to take that patient, but we're not. So a lot of times you're going to hear no from us, and everything we do is for your well-being. And we're not trying to we're not doing funny things just to make money. Yeah. For example, lipo, it's just it's a very it sounds very simple, but lipo is a very extensive procedure by itself. Recovery of these plastic surgeries are a big deal, and so anyway, just some pointer. So they're asking about hair loss after bariatric surgery.
Sometimes patients develop the hair loss after bariatric surgery when the patient previously have a deficiency of some vitamins or nutrients. But you could avoid or shorter that situation with a very good supplementation. That's why it's more frequently in malabsorptive procedures. But if you are going to have that procedures, you could avoid it or shorter with a very good supplementation.
That's another plastic question. What BMI is required for mummy makeover and breast augmentation? That's another good question. We have, in general, okay, we talked about BMI. BMI is not the only criteria of how much weight, are we obese or not, because again, depends on our body, bones, every body shape, bone density, everything. But in general, we don't do more than BMI of 33. 30 to 33 depends on whether you're post-bariatric patient or not. And believe me, we've seen, even in US, they take patients that they have a BMI of 40 and they do plastic on them. What happens with those patients is they do plastic and then now they have to come do bariatrics and then they need another plastic again. So be very careful. We want to make sure you are a good candidate, whether you're doing plastics or bariatrics, but it's not, it's not a good idea to, and then some patients think that like from lipo, they're going to lose weight. That's not the case. Lipo only takes maybe 5 pounds of fat. So it's for really under the skin fat. It's not the removal of fat around your organs. That's the difference, right? Obesity is fat around your organs, but body contouring like lipo 360 and all that, it's just to recontour your body. So that's the difference. We do that often. We see that they apply for lipo thinking like lipo is like they're going to lose weight with that. That's not the case. Yeah.
That's actually how I started with my weight loss surgery. I called MBC trying to get, no, I called MCC trying to get lipo or weight, a tummy tuck, but I didn't understand at that time that I was overweight and I didn't qualify at that time. I believe my BMI was almost 38 at the time. And that's when I opted out. And Amelia, my coordinator at that time, she's the one that told me that I needed to lose weight and suggested the gastric sleeve first. And then 4 years later, that's when I did my mommy makeover. So I was really appreciated of giving me that advice and leading me to the right way of what I needed to do to get to these steps where I am now.
Well, thank you. Yeah. Again, honestly, I've seen patients 40, 45 BMI that they have done tummy tuck and stuff lipo in US. I'm not even gonna talk about Mexico. I'm talking about US. They just want the business. They want the money. They don't care about, okay, what's gonna happen to this patient? But we're very careful about giving patients what they need. And that's another thing. We were talking about, Dr. Osuna mentioned about all the procedures that we offer. So for us, it doesn't matter if you get a gastric balloon or you get DS, because we can offer all the procedures. We look to see what's the best option for you. We see that often. These surgeons that can only do sleeve may be a low BMI bypass. So they try to steer you to say, hey, bypass is not good for you. You should go with the sleeve. Even between bypass and DS, some patients do need DS. That's what Dr. Osuna mentioned from the very first sentences that she started talking today was, I am here to give you what's best for you. Okay? So 15, I was just reading the other day, the results of 15-year study they did past post-bariatric patients. And they're finding out that DS has the best weight loss, best maintaining the weight loss, and the comorbidities reversal. So you can't say, well, just DS is too aggressive, or no, some patients do need that type of surgery. And we give them that type of surgery because we're capable of. We're giving them, if a bypass, let's say a patient needs a bypass and their BMI of 55, we can do it. Not every surgeon or every center can do all that we can do. So for us, we can give you plastic, we can give you bariatrics, but we select the best option for you. And this is huge. You want to go to a center that has all the options available, and they're not just trying to take your money and say, okay, no problem, we give you a sleeve or we give you a lipo, which is not really good for you. Okay, how about this, doctor? Is going to say, so they have had gallbladder removal and they're asking how much time they need to wait until they get weight loss surgery?
It's almost the same answer. If the gallbladder was laparoscopic, 1 month is enough. It's different when the previous surgery is open, because when the previous surgery is open, you have to wait more time, because we introduce a gas for meta cavity, and the open surgery has to be healed before that. But if it was laparoscopic, 1 month is enough, and we can make both surgeries at the same time if you need it.
And here's another thing. Again, we're talking about plastics more today. So when we take patients for plastics, we take your pictures, we consult with the surgeon, and find out with your health history what's the best option for you, and how many of these procedures we can combine in a mummy makeover. Okay, and then another thing is, if you know your gallbladder, we don't just remove gallbladder because you ask for it. We need to have study done to make sure you need a gallbladder removal. But if you do, we can do it simultaneously with the procedure. So you don't have to go through two different procedures. Same thing with fibroids and sleeve, right? We can do gallbladder with the bariatric surgery. This is huge because every time you go under, it's a risk, and you're basically putting stress on your body. Okay, so the less times you go under operation, the better you are. Okay, so they're asking how much would be. Okay, so just giving you ballpark, I think it's, if you were to do fibroid and sleeve, I think it bumps up about $2,000. Again, you know, I'm just throwing some numbers, but like approximate, okay? Yeah, so we could do gallbladder with sleeve. Yes, Amanda, that's exactly what I was talking about. So as a rule of thumb, we don't want you to lift anything more than 20 pounds. Especially, remember, when you go in, that's why we want you to pack light when you come down there. The weather is not extreme. We don't have extreme cold or extreme hot in Tijuana, because it's like a San Diego weather, right? So pack light. Don't, like, even picking up your suitcase and putting it in the upper compartment, you have to be very careful, not to lift heavy weight, yeah. So like a baby, 11 kilogram is about 23. Yeah, that's just about limit. But again, listen to your body, take time, give your body time to heal, whether you're doing plastics or bariatrics. Okay, so we're getting to the almost 10 minutes to two-hour mark. I still have about 20 more questions. We appreciate your questions, and it's great, but I think we're going to stop here. We would try to get back to you to see if your questions are answered. If not, to try to answer. If you didn't hear you, every patient is assigned to a patient coordinator when you first apply. And that patient coordinator knows your case the best. All you have to do is circle back, ask the question, and we would be trying to answer that. Okay, so I have all the names that are eligible, that they did a health questionnaire, and they did fill out the Zoom poll, and they did all that, and they all are here. And I'm going to pull one name. out and see who is the lucky winner. Whoa. Okay, so Tina Kavanaugh. I hope I didn't say your name wrong. So let me find you here and let you share your experience with us. Okay, there you go. There you go. Tina. Okay, Tina, I'm going to let you talk. Go ahead and unmute yourself and tell us about yourself. First of all, congratulations. You are the lucky winner of our raffle for this month. Tina, do you hear me? You need to unmute yourself so you can talk to us. Okay, so let's see. I don't see her unmuted yet. And Tina, do you hear me? Okay, well, that didn't work. So, well, appreciate Dr. Osuna taking time joining us. Kelly, thank you so much. Thank you, everyone else. It's been a pleasure to be with you, and thank you for spending your time with us. I hope to see you next webinar or being a patient, and we see you down there. Don't forget, Kelly is going down there August 18th. And I'm down there often, so just stop by and say hi. We'll be more than happy to see you. Okay, thank you again. We'll see you next time. Thank you, Dr. Sina and Kelly. Goodbye.
Bye, y'all.